Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Terima kasih Tuan Pengacara Majlis. Seterusnya kita akan teruskan ke plenary yang kelima ataupun plenary yang terakhir untuk pagi ini. Jadi terlebih dahulu saya ingin memperkenalkan penceramah kita yang kelima untuk plenary yang kelima ini. Nama beliau ialah Dr. Azlan Helmy Abdul Samad, merupakan pakar perubatan kecemasan dan pensyarah di Jabatan Kecemasan PP UKM. Beliau mula melanjutkan pelajaran di ijazah di University College Dublin, Ireland, dan kemudian sambung bekerja di houseman di HKL pada tahun 2008 hingga 2010. Kemudian beliau mendapat MO di Hospital Kuala Pilah Emergency Department pada tahun 2010 hingga 2012. Kemudian beliau melanjutkan pelajaran beliau Master dalam Emergency Medicine di Universiti Kementerian Kesihatan Malaysia. Okay, tajuk yang beliau akan bentangkan pada pagi ini ialah berkaitan dengan Public Health Emergency International Concern. Sebenarnya kita sudah maklum WHO, kita pilih tajuk ni kerana WHO telah mengeluarkan statement menekankan aspek international concern dalam public health emergency. Dalam intipati beliau, sedikit, beliau akan menerangkan tentang pengalaman apa yang berlaku di seluruh dunia, apakah penyakit-penyakit yang telah berlaku, yang telah pun berada di sekeliling kita, dan juga bagaimana Pakatan Kesihatan boleh membantu dalam meningkatkan perkhidmatan dalam kepada kesedaran kepada publik. Tanpa melengahkan masa, saya menjemput beliau untuk menjadi ceramah beliau. Silakan.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning. Thank you, Mr. Speaker, sir, atas very kind introduction. First and foremost, I would like to thank the organizing committee for the wonderful opportunity for inviting me to be part of this very wonderful and great conference, full house. So I'm truly honored to be part of this great history in waterfront JB. But inshallah, we'll make a discussion very smooth, and the task given, as you can see, is to discuss about public health emergency, international concern. Now, as I bought the aeroplane yesterday from Subang to come to Johor, it made me realize and it made me remember one of the incident that we had in 2009. If any of you remember, in 2009, there was a student, a Malaysian student, who traveled from the United States of America, a 24-hour long-haul flight, arrived in Malaysia on the 13th of May, 2009. So exactly nearly 7 years this month. And upon arrival to airport of Malaysia, he actually kept something with him. He was having fever, he was having sore throat, and he was having persistent cough. Upon arrival to the airport, he somehow passed our thermal check, but he went to check for himself because of the persistent symptoms, and little that we knew, he was the first index case for our H1N1 pandemic in Malaysia. Now, what is the impact of that first index case to our country at that time? It was a huge chaos in terms of the Ministry of Health, the first index case, because at that point of time, it was already announced to be a global pandemic. In many parts of the world, people have been dying and diagnosed with H1N1 influenza. So the government had to trace everybody in the aeroplane. Just imagine it's a 24-hour long-haul flight, few hundred people in the same aeroplane, and every single person need to be traced and tracked where they were. It's not an easy task, but it needs to be done. Because the moment you have a positive influenza virus during a global pandemic, everybody in the aeroplane has the potential to be a super spreader. It's a very scary thought. But luckily for this young man, he survived. He was kept and treated in hospital Sungai Buloh, and the government managed to trace all the other passengers. And if I tell you that a single cough and a single sneeze has the potential to kill everybody in this hall. A single sneeze, a single cough has the potential to spread in the whole of the aeroplane. How would you feel? Because that brings to the topic that we're discussing today, international concern when it comes to public health emergency. One may wonder why an emergency physician talking about a public health emergency. But let me tell you, when it comes to public health emergency, it does not matter whether you are working in the hospital, whether you're working in the administrative, whether you're working in Kementerian Kesihatan, Clinic Satu Malaysia, or wherever. As long as we are part of the Ministry of Health or part of the healthcare fraternity, all of us need to know this, because it can hit you, it can hit me, it can hit us very hard and has potentially killing all of us. Now, look at this picture. Can I have a show of hands? Anyone has got an experience, anyone sneezing direct to your face? Siapa-siapa pernah ada pengalaman tak orang bersin hachoo dekat muka? Ataupun if not direct to the face, is within the 1 meter radius of that sneeze. Now, look at that picture, because for a number of years and decades, people have been thinking the cough and the sneeze is dangerous. But no one ever studied that. But guess what? Who did the first study and who did the extensive study? It must be the Japanese. So the Japanese has studied our cough and sneeze. Okay, what they found and what they did. Okay, based on this picture, as you can see, the first row is actually the picture of the sneeze taken without any effect or image to the video. The one below is the one that he sneezed, but with the effect of the camera to see how much particles were there, how fast the particles actually travel. So interestingly, it was taken only from 0.01 second to up to 0.4 second. You see, not even 1 second. They calculated the sneeze of a normal, this one is normal individual. They don't take anyone with diseases, putting everybody at risk. So they take a normal individual and they count the moment the person sneezes until the sneeze disappear. Okay. So the maximum is up to 0.5 second, then they'll see the effect of the particles disappearing. However, what they found is quite interesting, because this is the fundamental for us to understand, because we are dealing with cough and sneeze every day. We are the frontliners. We need to know what is there that come to the face that we are inhaling from our patients. So these particles contain particles of various sizes. Millions and millions of particles of various sizes. The largest one, or for example, if the one that has size of more than 5 microns, it will only stay afloat less than 0.5 second, and it will not travel more than 1 meter, at most 2 meter. But if the particles is less than 5 microns, if I sneeze from here, the particles will remain afloat in the air. If without aircon, it can stay float in the air because it's too light, but with the effect of fan and our blowing effect and the effect of air condition, the particles can slowly travel from here probably to the back of the hall. And the person sitting at the hall thinking that, okay, that person sneezing, nothing, no issues. But that particular particles can slowly fly and fall on his nose, and he will inhale. The size of 5 micron is very small, that it will travel into the trachea, it fall and sit in the alveoli and starts the pandemic. If the person does not carry any virus, fine. What about the person who traveled along with the H1N1 patients in that MH091? It's a scary thought, but this is the challenges that we as healthcare professionals has to bear in mind. Now just have a look at this video. Okay. Look at video number 2. Slow effect, 1 in 300 seconds. How much particles were there? Just imagine you being sneezed just right to your face. You are getting this. If you sneeze next to the person of yours now, if you sneeze at him, he will inhale the big particles and the small particles. That's it. If you sneeze here, the person at the back has still got the potential of getting all the bugs from you, but the big particle will fall on the floor. Now, for our side, as healthcare professional, we work in the hospital. It's important to make sure that our cleaners always clean the floor, because the particles in the hospital and the floor of the hospital actually full of bugs and virus because of the cough and the sneeze of our patients that come to our hospital on daily basis. And studies have shown these are the potential medium for the outbreak to occur as well from indirect contact. Now, that leads to the discussion, and my objective of this talk is very simple. The first one, after the end of this lecture, we as healthcare professionals should be able to discuss public health emergency openly and thoroughly and with full of academic knowledge. Number 2, demonstrate the understanding of the public health emergency and incorporate this understanding into our daily practice. Disseminate the knowledge to our colleagues, to our other practitioners, and of course to the public. So, to make it more interesting, what we'll do today, I'm going to bring all of you together with me. We will travel around the world. I'll give you an example of what we have learned in the past history in different parts of the world based on these stories. I'll tell you a story about King Alfonso XIII. I'll tell you the story about Prof. Liu Jianlun. You must be wondering, who is this person? The story of baby Emile and story of Olympic. Now, if you know the enemy and know yourself, you need not fear the result of 100 battles. If you know yourself, but not the enemy, for every victory gained, you will also suffer a defeat. If you know neither the enemy nor yourself, you will succumb in every battle. This is what Sun Tzu said, the author of The Art of War. He's a general of war by himself. Well, what it means, put ourselves in the war. All of us are the soldiers. All of us are the soldiers that will determine the future of our country. If we do not understand the disease, if we do not know what is public health emergency is all about, if we do not know the severity of H1N1, if we do not understand what is Ebola is all about, dengue virus is all about, disaster is all about, then we will not plan for it. So not to succumb to this, we need to have a resilient, knowledgeable, clear awareness about this topic, and it's very much coincide with the theme of the conference, which is wellness focused professional for better healthcare. So we need to know our enemy. We need to know who's the general. We need to know what is their strategy. How do they replicate themselves? How virulent is the virus? Can they pass through the sneeze? Can they pass through the fecal material? Can they pass if we pass the cut to them? Things like that. It all has been documented from the previous history. Now, I'm sure many of you have watched this movie before. It's called War of the Worlds by Tom Cruise. It's about, I think, in 2005 or 2006. What is interesting about this movie is what Sun Tzu said. This movie is basically about the aliens coming to invade the earth against human race. And of course, the aliens have got all the technology and advancement in the world to basically put and crush the earth. What happened? This movie ends with the alien basically losing the battle, but not to us. The aliens did not lose to human. when the moment they arrived, all the aliens died because they did not expect there were millions and millions of microorganisms that can evade their body, and they died because of their immune system not prepared for that war. Even though they been studying the human, but they did not know there are other enemies that can kill them. It relates to what we have learned earlier. Not understanding the enemy can kill us. Now what I'm going to do today is to enhance our awareness about this public health emergency, to understand the danger of influenza virus, the danger of this pandemic, the danger of this outbreak, and the importance of us as healthcare professionals, be in the clinic kesihatan or wherever you are, to detect this. The early detection may save millions and millions and millions of lives. Based on what Ismail mentioned earlier about international health regulation, we are bound to this IHR 2005 when they talk about public health emergency. What is it actually is all about? In 2005, 196 countries have come together and agreed, based on the WHO commandments, that we will work together to prevent the spread of diseases. We will follow the steps in accordance to what WHO has laid out for us in order to prevent disease from spreading to another country. And back to the resilient, to uphold this whatever WHO is trying to say, because the Ministry of Health is bound by what WHO is saying, and we learn from the past that if we do not follow the guide, more people will die. So I put myself together with all of you. We need to have a universal soldier team, a versatile team, wellness-focused professional, knowledgeable, resilient, ever ready, fully aware of what's going on, and ready to disseminate the public knowledge to other people, whether the public or other healthcare professionals, so that we are ever ready to face whatever challenges. Put yourself as the universal soldiers, yeah? And the question next, what is public health emergency? Of course, it's a big topic. We are focusing on the outbreaks and pandemics, but based on the definition, it expands beyond that. It includes bioterrorist attack. It includes the disaster, flood that we had. It includes other catastrophic events as well. But we don't have the scope and the time to cover everything, but I will cover the most that kill us most, which is the pandemic, and the most dangerous and the one that we don't see. The tsunami, the SARS, and the biological weapon of anthrax that I've mentioned earlier. And public health emergency of international concern, as defined by WHO, is an extraordinary event which it will constitute the public health risk to other member states through international spread of disease, and also as a potential that requires a coordinated international response. So based on these two, if it fulfills, then the director of WHO will have to do something, whether to announce it's actually an international concern or not. The moment it's announced that way, then the whole world will put in alert mode. I mentioned earlier the expansive definition. Before this, it was more focusing on the disaster, more focusing on the pandemic influenza. But as we go along, we've learned that there are more than just that. We are facing with a new type of war against terrorism, bioterrorism, anthrax. And recently we had one incident in KLIA, even though one patient, but it's already causing a huge catastrophe in terms of media, political relationship with countries. So these are the potential things that we as professionals in the medical line need to be aware of. And what the potential transmission from person to person, such as SARS, influenza, polio, Ebola, through food, such as sometimes we import and export poultry, chicken, geese, ducks. We import, export pork, cows. These are all the potential breeder for zoonotic infections, and without we knowing, it's part of our job as well. There are people, maybe the MA are going into this line and working with the serum and stuff. Vectors such as dengue, yellow fever, West Nile fever, and of course the environment. And the moment we have this alert from the international concern about any event, it must come first with detection. This is our job. We must first detect the presence of this disease. With the detection, somebody needs to verify. This is a simple step I tell you. Risk assessment, whether or not it's really a pandemic, whether or not it's just a cluster, 1 or 2 cases in 2 klinik kesihatan as opposed to 2 cases in 4 klinik kesihatan. So the pattern of diseases and the patterns of emergence of diseases will bring us the pattern and will alert us as the practitioner in medicine to notify our authority. In JKN, for example, okay, boss, we have a case, a cluster of cough and runny nose, looks like influenza-like illness. Do nasal swab, and little that we knew, it is actually the start of a possible pandemic. And of course, once it's confirmed, we need to respond. A simplified version of international health regulation, as you can see from the black box below, I've mentioned we are always on the passive surveillance mode. At this point of time, we are on the passive surveillance mode. Every day, the occurrence of infectious diseases that have been notified through e-notification, right? And somebody will be checking the e-notification, saying that, okay, no alert about these possible outbreak cases. But the moment there is, that is considered a detection. And it will bring us to the next level, whether or not we will activate from passive surveillance to change into active surveillance. And we have to inform the higher authority, the national, international health regulations in our region. If the clusters becoming more, the possible outbreak, then go higher level, which is WHO IHR in the region, ASEAN region. We'll look into other countries, whether Singapore is affected, whether Thailand is affected, whether Vietnam is affected. And if there are patents in the region, WHO boss will be notified, and they will look into other parts of the world, such as Europe as well. And that's how we knew that there's a possible pandemic. But it all started from us, the ability to detect and having high index of suspicion to know the coming or emergence of these diseases. The criteria for assessment, this is very important. For us to know whether we need to notify WHO or not, ask ourselves, is this a public health impact that is so serious? If the answer is yes, the next question, is the event unusual, or is it just another dengue virus, or is it more than that? Because the dengue virus plus the baby that is born has got a small head. It creates a question to ourselves. If this is unusual, how come a dengue baby came out with a small head, a microcephaly? That's what happened in Zika. So somebody has high index of suspicion. How come suddenly for the past many years there's only 200 cases? Why in 2015 and 16 there are 3,000 babies born with microcephaly? So it's unexpected. Is there a significant risk of international spread? Little they knew, after more babies born in Brazil, then there was also babies that born with microcephaly in other parts of the world. Third and fourth question is significant risk for international travel or trade restrictions and political restrictions. If 2 of these are present, then we need to notify WHO. What are the prerequisites for a pandemic to occur? Pandemic is basically an outbreak that occurs that involve beyond the borders of the countries. First, the virus must be novel. It's not something that our body are used to. It's not the normal flu virus that we face every day. It must be novel. Something that possibly come from monkeys, come from the pigs, come from the birds that jump into our body, the system, and replicate, but the body has no immunity against it. The vaccine did not prepare us for this new novel virus. Number 2, the virus are able to replicate themselves in humans. There are a lot of cases of influenza virus detected in pigs in China, but they are not able to jump, cross from pigs to human. They remain among the pigs. That's fine. But the moment they know the patterns of replication in the pigs are so fast, we are worried it can transform and mutate themselves and transfer to human and start having pandemic, because the moment they can transfer from human to human, these are the 3 prerequisites for that virus or that bacteria to become a pandemic source. Now, we'll start a story about King Alfonso XIII. Now, you must be wondering, okay, who is this King Alfonso? King Alfonso was the king of Spain during the 1918 influenza pandemic. 1918 influenza pandemic was known as the Spanish flu. But it is not coming from Spain. It did not come from Spain actually. It's a misnomer. 1918, okay, who here that is old enough to actually live from 1918 until now? Because that makes you 100 years next year. Anyone? No, okay. What is important for us to learn? Because the human race have learned so much from this 1918 Spanish influenza pandemic. In 1918 was the time of World War I. That just made things compounded, made things more difficult, made things more even worse. It was the war that involved the European and also the Americans. But Spain was a neutral country. During that time, the first influenza, after being studied by many literatures and researchers, it was not coming from Spain, but instead it came from the United States of America. The influenza virus affected the soldiers. All the soldiers were being deployed from States to Europe. Some of them has got very severe illness and they stayed in the US. But those with mild illnesses were allowed to travel and go to Europe and go to the war. The problem is during that time, there was a wartime censorship, regulation and restrictions. Those countries involved in the war, they're not allowed to tell anything that happened in their country. Same goes to France. France also had an outbreak about the similar symptom, but they kept that as a secret. The moment the virus reached Spain, Spain was not under duress of war. They are not under the wartime censorship restrictions. They are actually a neutral ground at that point of time. So it was made public. There was an influenza outbreak and epidemic in Spain. And because the time the king himself was actually infected and severely ill because of the virus, the whole world thought it was actually coming from Spain that time. So the whole world will call it Spanish flu. The whole world will call it giving instructions to commandment to other people to be careful with the to travel to Spain and stuff like that. So now we are in Spain, but we know it coming from Europe and also coming from America. And the Spanish flu, surprisingly, because of that novel virus, because no one knew if it was actually coming from the intermingling between the pigs and the avian, and to make things worse, the recent study have shown what contribute to that massive dissemination of the virus, because during the wartime, people are actually stressful, physically, mental, not enough food, no vaccination, no medication. They have got all what it took to have the pandemic to spread like fire. So the learning point from that is that we have failed to contain the virus. The pandemic of Spanish influenza have killed 50 to 100 million of people at that time. Just to put things into perspective, 5% of the whole total world population wiped out. 5%. At that point, the whole world population was only about 1/6 of that we have now. But still, it was scary. It was changing the geographical, the effect of the war itself was different because everybody was sick. People cannot be selling their food. No one have interaction among each other. And one of the recorded in the literature, they were trying to find where are the history and also the reports about this. Not much report was found because everybody was sick. Even the reporters, the journalists were sick. So who's going to report? Little. But these are the scary thoughts. Influenza in Spain, or Spanish flu, not in Spain, the Spanish flu have killed as many as 25 million people in the first 25 weeks. It has killed more people in 24 weeks than AIDS killed in 24 years. And as I mentioned earlier, it has killed 5% of the whole world population. And the mortality is 20%. Every 10 patients that you treat, 2 will die. As opposed to the seasonal influenza, only 0.1 to 0.2%. Every 1,000 seasonal influenza that you treat, 1 or 2 will die. That's the difference. 2 to 10 and 2 to 1,000. And we have to understand, they are seasonal influenza, they are pandemic influenza. What we deal every day in our life, we will get H1N1 still now, but those are most likely a seasonal influenza. Seasonal influenza occur every year. We have vaccine against that. As long as the seasonal influenza does not replicate and mutate themselves to become a new novel virus, as long as the human body can detect, can go against it with our immune system, it will not cause much of a problem. But the pandemic influenza usually is brand new. It's a brand new BMW that come into no one recognize. So, but most of the time, the body can recognize it's a Mercedes, it's BMW. But this one is new brand new car, no one knows, and it start hitting people in the ground. So that's how it works. And this is a scary thought as well. Look at the graph. The graph shows that the mortality was highest among the youth, people who were young. How come? Because the seasonal influenza should otherwise. People who are young and the elderly will die. But the pandemic influenza should otherwise. Those who were young were mostly dead. They are actually soldiers. They were actually young people who had no medical illness at all. But now we knew why that happened. It was the cytokine storm. Young people have got good immune system, has got good response against diseases. But that cytokine storm is too much, overwhelmingly, effectively killing the patient themselves. And we're afraid the same thing could happen in the future. Because that's what happened in dengue nowadays as well. We have learned in the past, these are all the previous pandemic that we had in the past. We had pandemic of H2N2, H3N8 in 1900, and we get the H1N1 in 1918, which was the worst in the history. We've got H2N2 in 1965, and 1968 again in Hong Kong, influenza, H3N2, almost causing alert, but not much as compared to 1918, and then comes 2009. In 100 years, there are about 3 to 4 pandemics. And epidemiologists are predicting the same pattern. Every 30 to 40 years, there will be a huge pandemic occurring. But again, we have to be on our toes all the time because it can always come to our door anytime, anywhere. H1N1 2009. If you're afraid of 1918, then we can say 284,000 millions of 284 hundreds of mortality is not that much. True, as compared to 1918, it's not that much. But look at this graph by WHO. The moment we had the pandemic of that child being detected in Malaysia, the rest of the world is already chaotic with death and also increased number of H1N1 influenza being detected. It's a novel H1N1, even though the same strain as 1918, but somehow or other, the H1N1 virus is so good at mutating themselves that there's actually a brand new that just jumped over from swine, from the pigs. They detected it from the pigs, it jumped across to human and caused this H1N1 pandemic. The one in grey, the one in brown were the countries affected by H1N1 pandemic influenza. You can only see a few white map area that is not affected by the H1N1 influenza. So you can say within that few months, the whole world has been affected by influenza. And these are the areas that they have detected H5N1. That means they detect influenza among the birds. They are putting an active surveillance among these birds, the hen, the chicken, the geese and the ducks. Because they're afraid it can jump from chicken and ducks to human as well and cause another pandemic. So these are all put under surveillance, and Malaysia is still, white color, alhamdulillah. But the rest above us in China, because China has been known by the Dr. Oxford from Oxford, he said that China is the incubators for this virus because they have intermingling of cats and dogs and pigs in one area, and there's very, very high chance. It's a nightmare for the virologists. It's a nightmare for virologists. because they can having a virus that come from the dogs jumping into the birds, from birds jumping into the pigs, because they're all put in one area in the market. But thank God, in 2009, the pandemic could have been worse. The data have shown that the onset of the pandemic did not occur in the third world country. The first detected pandemic was in North America, which had an established public health service, good detection. Therefore, the Americans told the other parts of the world, listen dude, we have a possible pandemic, a new novel virus has been detected, please be alert. So the whole world has been informed based on the established system that they had. So that helps. It could have been worse if it comes to any developing or underdeveloped countries. Just imagine. Number two, the communication. They use internet very well. They spread the knowledge through internet and newspapers. As opposed to 1918, there were no such thing before, so people do not know. And the vaccine was available. People are more aware of the ILI symptoms. The antiviral was also available. Tamiflu has been recorded and has been allowed to be given to the public. And the virulence of H1N1 at that point of time is not as bad as the virulence of in 1918 Spanish flu. Now, that's the end of the story of King Alfonso XIII. If at all we learn something from that Spanish influenza virus, we learn to keep calm and expect the unexpected. For years and years, people thought it's going to come from China, but it came from Mexico and North America. People thought it's coming from the bird, and it comes from the pigs. People thought it can only kill through sneezing and coughing, but it also can occur through touching. So we are fighting against something so difficult to understand. So bear in mind, keep calm, and just beware of it, have some knowledge, and we go to the next map. Now I'll bring all of you from Spain to Europe. Now we go to Hong Kong. This is another interesting history. I would like to tell you a story about Prof. Liu Jianlun. In 2003, had a SARS outbreak, remember? And Prof. Liu Jianlin is a consultant in a hospital in Guangzhou, China. Months before he traveled to Hong Kong for a wedding, he actually treated a cluster of patients who had symptoms that he did not understand. He noticed the patients were dying. He noticed the patients was having URTI symptoms and having ARDS. Some of them died. The problem is that it was not notified. He treated the patient, he kept it as a secret. Then, in 2003, in February 2003, he traveled from mainland China of Guangzhou to Hong Kong. He traveled by bus, full of people. Along the way, he arrived to Hong Kong, China for the wedding, but he brought along with him a big secret. He was having URTI symptoms, he was not well, and he was complaining of shortness of breath. 2 days after arriving in Hong Kong, he went to the hospital in Hong Kong and straight away was given NIV support, intubated, and later on he died. But before he died, he gave a confession to the doctors in that hospital that he found a similar pattern of diseases back in Guangzhou, but was never detected, or was never notified. It was kept a secret, only the hospital knew it. And some, even worse, some of the healthcare givers in that hospital were sick as well. He was indexed of SARS patient 1. That is the start of the virus, that is the start of the new pandemic in 2003. Now what happened next? The government of Hong Kong had to trace, because they noticed that the moment this patient died, other healthcare workers start having symptoms as well, and they get worried. And many of the healthcare workers become sick because they attended their friends, they attended their patients. And with the fact that they knew in Guangzhou there was actually some outbreak of unexplained severe respiratory symptoms, they had to warning the global world there's a possibility of a new pandemic. They thought it's influenza again. But the virologist and the microbiologist, the consultant in Hong Kong, take a tissue from the Liu lungs, and what they found was coronavirus, a virus that usually were very benign. But that particular virus eats up this doctor's lungs and basically caused APO and ARDS and killed the patient. It was a scary virus. To make things worse, the virologist said, the body is not used to this virus. We have no antibody against it. It must have jumped from another animal to human as well. To make things worse, Prof. Eugene actually stayed in the 9th floor of Metropole Hotel. Together with him for the past 2 days, he's been coming up and down through the lift with other people from other parts of the world. And he has become the super spreader because those people travel back to China, travel back to Ireland, travel back to Vietnam, travel to Singapore, travel to Canada. It all started from that particular person, Prof. Liu Lianjin. And the whole world was in panic. The whole Hong Kong, in the space of 2 weeks, they have got almost 130 patients died. Because some of them who traveled with Prof. Lianjin from Guangzhou to Hong Kong on the bus got infected as well. And one of the most famous outbreak, which is called Amoy Gardens. Amoy Gardens is actually a flat that had affected almost 200 of its inhabitants in the space of 3 days. And virologists, epidemiologists all puzzled. How come the outbreak can occur in a vertical manner? Because they always say it must be passed on in a horizontal manner. Coughing, sneezing, touching. It must be horizontal. How come from flat all the way up, 200 people in the space of 3 days? It was a very scary thought for the people around the residence area. And Amoy Gardens became the most famous apartment in the world at that time. And the whole team came with their PPEs and all that to disinfect the area. The whole inhabitant had to be isolated. This is one thing you should learn. The Hong Kong people and the government took a very drastic actions. They took all the inhabitants of Amoy Garden and bring it to a disused hotel and isolate them for 10 days. Actually, that helps. Even though it requires huge enforcement from the military to do that, but it works. So they managed to disinfect the whole area, and they found out, this is one thing about coronavirus or SARS that's so scary, they found out it leaks from the sewage. From the sewage system. So the virus can also travel to the fecal oral, and whenever they pump the fecal oral after you pass out your motion, that has a virus in the toilet, it can travel through the sewage, become aerosols. From water, it become airborne, and it start to infect the people. And they found out as well that whenever people travel along the leaf, they touch. So the second person touched the same button, he got infected. So not just through cough and sneeze, it travels through the sewage system, it also travels through contact. That is SARS. And it brings the whole world into panic, and after a few months, we had 774 deaths, and Malaysia was not excluded. We had 2 mortality, and Canada had the worst, because the first index patient was an American-Canadian, it's a Canadian who actually traveled together with Prof. Eugene in the lift, and Prof. Eugene had cough in the lift just with him, and they stayed in the same floor. So there are a lot of factors that contribute to the death of that Canadian young man. 10% of SARS victims die. Every 10 patients, 1 will die. But what is worse, 21% of this mortality were among our friends, the healthcare workers. How do we prevent this? We have to treat our patients. Semasa sedang, orang kata, when they are most contagious and infectious. If we don't do our duty, we are not doing our job. But at the same time, the healthcare are risking our life. We are risking our life to save these patients. And what have been studied? The healthcare worker, we always know we have our surgical mask and then N95 to be worn during our outbreak. But studies have shown it's useless. This is the scary part, because whenever our healthcare worker put on a 95, they got headaches. They become discomfort. Some of them cannot focus on their work. So these are the contributing factors that can make it difficult for us to manage our patients. I've mentioned here about the airborne and droplets difference, just to highlight about the pertussis and influenza and mumps being droplets, and measles and tuberculosis being airborne, and SARS also is part of droplets, and some of it can aerosolize and become airborne. This is a simple diagram to show you from infected individual, the droplets less than 5 microns stay in 1 meter, less than 5 microns travel more than 1 meter, but some of them can occur to other patients through direct contact or indirect contact. Socially, in Hong Kong during that month, do you know what happened? No one sell anything to other friends, no one shake hands, no one pass their business cards, no one touch the railing, because they know it has a possibility of direct contact or indirect contact occurring. So it changed the whole scenario of the country. Airport was empty for 1 week. No one traveled all around the world. So this is actually a catastrophic event in terms of economics, political and stuff like that. And that's the end of story of Prof. Eugene. One thing we've learned, SARS spread very fast. Direct contact, indirect contact. But the most important thing, if you notice anything different among our patients, do not keep it as a secret. You're not just killing your patients, you're killing yourself and the rest of the world. It's not fair. Now, I'm going to tell you a story of baby Emil. This one, another sad story. I'm going to bring you to Africa, to Liberia, Guinea, Sierra Leone, and Nigeria. Baby Emil is baby index 0 for the Ebola case. It's an infant, 2-year-old infant, who had symptoms that the mother and the doctors cannot explain, and she died. But what triggers the spread? Because no one knew what was it. The mother was sad because the child died. They hugged her, they kissed her before they buried her. The sister hugged her. The grandmother come and hug her as well before they buried her. Of course, natural instinct of parents and family, of course we will kiss our kids before we bury them if they die. But they did not know that baby Emil is the carrier of the most deadly Ebola virus in the history. Until now, scientists still in puzzle why this baby has got the disease. Whether he or she has ingested something, because it comes from animals. Why did not the parents start off with? Why the baby? We do not know. The problem is, this is the sequence. Baby Emil died. Philomene is the mother, the sister. Sia is the mother. Kumba is the grandmother. Few days after they hugged the baby, they were sick themselves. And the grandmother went to the hospital and get treated by the nurse. And this all going on. They still do not know what was the symptom, they just treat like another patient. And with alarming speed, more and more and more people are dying every day. And this has been going on for months. This is the importance of early detection, because this was not detected and was not put in alert mode for months. So many people in Africa were affected by Ebola without they knowing it, and they died. The moment the scientists realized, oh, it could be an Ebola virus, because Ebola, we have learned from the past, Ebola is even worse. It's not just spreading through the nostril and the sneeze and the cough. Every bodily fluid in your body has the potential to be the super spreader of the Ebola virus. And the symptoms were particularly non-specific. They had fever, but some of them developed some bleeding in the mouth and the nose. Some of them developed rash, muscle and joint pain, diarrhea and bloody diarrhea. Many of them developed just mild symptoms, but developed into hemorrhagic state whenever they are almost to die. And these symptoms were not known to many of the doctors there, because Liberia and also Guinea is not known to have Ebola virus before. So whatever I said earlier, the body fluid, it can be the urine, can be the stool, the vomitus, the saliva, the tears of that patient, blood, even the runny nose, breast milk, sweat, you name it. Everything that the patient has got replication of millions of virus in that small millimeters of fluid. So that makes difficult. That makes healthcare people to respond very difficult. And this is what happened. It's a very dramatic scenario. The moment they know it's announced it's Ebola virus, the moment they know they suspect somebody is sick because of Ebola, no one dares to touch. Put yourself in the situation where you know your son is infected by Ebola. Your son is dying, but you cannot touch your son. You cannot take care of your son. You cannot kiss your son. You cannot do anything with your son until your son dies. It's a very hurtful feelings for the parents of Ebola victims. The reality hits in. At first, the people in Africa was very against this. They were not following and obliging to the WHO commandment of not touching the patients. But then they realized the moment they care for their loved ones, they die. So the team had to go there and bring the body away from the public. Now in the picture, the second one, the wife can only see from distance. They cannot do anything. And they have a special way to bury the body. And they have to disinfect everybody that is around the house. So Ebola virus is another pandemic that is possible to travel to Malaysia as well. Luckily, Alhamdulillah, we never had a big pandemic. But the fact that the globalization allows people to travel, then we need to know the possibility of Ebola, because the management is even more difficult than SARS, because you need to pull full PPE, type A or B at least, to prevent from us getting it. Now the interesting part, you know what, Ebola was first detected in 1976. 1976. A priest or a nun died because of unexplained symptoms, and many people died after that. 1976, 1986, 96, 2005. It takes 30 years for scientists to understand the source of Ebola. From 1976, people thought it came from the chimpanzee. They thought it came from all the animals in Africa they can think of. But no one thought of bat. It only in 2005, 2 patients were infected in different areas, but both of them went to the same cave. That triggers epidemiologists. There's something in the cave that might have caused this virus. And true enough, they took the sample of those bats in the cave, and those bats were a long-standing carriers of the virus. The question that scientists do not know, why and how bats been carrying that virus, we do not know. Wallahu alam. Maybe you guys can do study on that. But bat has been known to be the carrier of Ebola virus, and what is even worse in Africa, what actually propagate this issue is that this. Africa, they do kari kelawar. They do soup kelawar. They do soup monyet. They do all sorts of soup, because they say it tastes really good. So if you can see the picture, I mean, I have no word to describe, but the moment I saw and I read the article, I was like, okay, it explains a lot. And because of that, it promotes the transmission. That's why the hypothesis that baby Emil could have ingested something that had been ingested by the bats. The bat might have eaten a fruit, and the baby eat the fruit as well. So whatever the virus that comes from the saliva of the bat may have transferred into baby Emil's body and caused the Ebola virus. One thing for sure, Ebola did not come from human. It is a jumping crossover virus from bats to human. So the interaction of human and bat to some extent is good. So Batman is actually very powerful. Maybe he has a carrier of Ebola for some reason, we don't know. And this how fast Ebola travels. In March, it was just in Sierra Leone. April, October, November, after a few months, the whole of Africa is affected. What compound the whole thing? Africa is a third world country. They have been facing with the most deadliest virus in the history of mankind. 50 to 90% mortality. Every 10 patients affected by Ebola, 5 to 9 of them died. 1 survived. That's how scary it was. But in Liberia, the ratio for patient to doctors is 1 to 70,000. Sierra Leone, 1 to 45,000. Guinea, 1 in 10,000. They cannot cope. That compounds the whole thing. This is the importance of us to develop our healthcare professionals, not just the manpower, the resources, but as well as the facilities. And Alhamdulillah, we are on the right track. But we have more job to do because we're probably helping the other parts of the world as well. This fact I've told you earlier, 1976 is the first outbreak in Ebola Yambuku. 28,616 cases of Ebola were reported. It's the worst outbreak in the history. 15 were confirmed. 11,000 died. And that brings the mortality between 50 to 90%. As healthcare professionals, as AMO, as the trainer of the new booming AMO, we need to inform this to our colleagues. The moment they hear Ebola virus is not just like any other virus. They respond with the pre-hospital team, full gear. They need to know what is the enemy. It's not something simple that we're dealing with. They are potentially at risk and potentially killing the healthcare profession as well. Now, that's the end of story Emil, baby Emil. What we have learned from baby Emil, that outbreak of Ebola, even though it's far away from us, we have the role and duty to understand the virus as well. Because scientists have said that the bat virus or the fruit bat is not just found in Africa. No one ever studied the bat in Malaysia yet. We have a lot of cave as well, and I'm sure we do not eat soup kelawar, so that somehow reduces the transmission. But at the back of our mind, we need to have this knowledge in mind. There's a possibility of a transmission there. Story of Olympic, as we all know, before Olympic, we were outraged and we were actually puzzled and shocked by this scenario and phenomena of baby being born with small head, Zika virus, yeah? Zika virus is not new. It has been there for decades. But what's new was that it causes microcephaly. Previously, it was just causing symptoms just like any other dengue patient. Myalgia, arthralgia, headache, some of them may go into hemorrhagic symptom, but not as bad as dengue. But then later on they found, why is this baby being born with small head? And how they knew, how the Brazilian government knew that it was actually from a virus, and how they knew it was actually from dengue. The emergence of these microcephalic babies was like explosive. 200 to 300 per year, and suddenly 3,000 for that year. And it's like few months before the Olympic in Rio. So the Brazilian government, of course, in alert mode, they know if this is not contained, no one will come to the Olympic Games. The athletes will withdraw themselves. The athlete will do everything to prevent themselves from getting this. The mothers will not bring their child. Lots of factors, social factors, political factors, economical factors has to come into the picture just before the biggest game in the world. So they look into these babies and do a retrospective study. Those with microcephaly, they take the sample of the blood of the baby. They take the baby who died, they take the brain sample of the baby. They take the amniotic fluid of babies in the affected area. What they found? All of them has got Zika virus in the brain, in the amniotic fluid, in the blood. So there's a very strong correlation. They cannot just say, oh, it's maybe association. No. The studies have shown a very strong relationship between the Zika virus as well as the microcephaly occurrence, and therefore they come up with all the preventive measures to make sure the public know. Even though microcephaly is not as deadly as Ebola, it's not as deadly as your SARS, but the problem is it has got something to do with the offsprings of our generations. That worries us most. Our children are born with a permanent damage. And to tackle this social issue, most parents will have the hope and asking the doctors, can their child survive and live just like any other child? The answer is no. Because when they're born, their frontal lobe is almost none. They are not going to develop their brain just like any other children. It's not the same. And the transmission from mother to fetus is real, and therefore the WHO has come out with a public health emergency guide to prevent the dissemination of this virus as well. So it's a global public health emergency, and Brazil was the hardest hit country. More than 4,000 babies were affected with microcephaly. And the symptoms, as I said, fever, rash, conjunctivitis, and has been reported in more than 25 countries, including America. And the spread of the virus is just like dengue in Malaysia, by dengue, albopictus and aegypti, albopictus especially. And we have lots of mosquitoes in our country. And there is a very strong lineage that it is possible to come to Malaysia as well. So back to our norm, prevention is better than cure. We do not have vaccine for Zika. We do not have vaccine to prevent or treatment for Zika. Even though the vaccination for dengue is coming, but for Zika is none. So there's nothing much we can do. What we can do is increase the awareness of the public about the importance of preventing dengue breeding area. I don't have any other lesson because I've gone through the literatures. It can only come out with this conclusion. We can only increase the awareness. It's our job. It's our job to tell the public, listen, we have dengue, we have lots of diseases that is spreading because of our own mistakes and our own ignorance. So kita punya tanggungjawab untuk sampaikan kepada masyarakat, buang sampah tu jangan ambil mudah. Buang sampah merata, even though sounds very like balik-balik pesan benda yang sama. But they do not know. By teaching their children not to throw rubbish in the drain, it prevents the drain from clogged up. It prevents the breeding area. It prevents other people from dying. It's not just about them. It's about our generation and our community. Lots of people have only thought, bukan kena dekat latih pun. They forget our role is not just for ourselves, but if you save your house, you're also saving other people's house as well. I like Albert Einstein's word, those who have the privilege to know have the duty to act. Now all of you and all of us now have the duty to act, because I already told you the big secrets of the international concern of public health emergency. Just to bring back to reality, we have traveled to Africa, we have traveled to Hong Kong, we have traveled to United States of America, we have been to Spain, we have been to many parts of the world. Now we are back to our country. What do we have to offer? What are we facing? Based on the Directive 20, all of us knew that it is basically emergency or any disaster is defined as a serious disruption of community function that is beyond the capacity of our country or community to cope with it. That involve lots of resources, a lot of financial, economical influence that is need to be driven towards safety of the public. And it's an incident that occurs unexpectedly, complex in nature, resulting in the loss of lives, damage to properties and the environment, as well as interfering in daily activities of the local community. The incident requires the management which involves resources, equipment, extensive manpower from various agencies, and especially all of us are involved, as well as effective coordination and the possibility of taking complex action over a long period of time. What we have got so far. In 1991, we had explosion of the factory fireworks in Sungai Buloh. 1993, Highland Tower condominium collapse. Even though not much of a public health emergency, but it is to some extent does cause public health disruption. 1995, landslide in Genting Highlands. 1998, we have JE. We have transmission of Japanese encephalitis or viral encephalitis that caused people to die because of infection to the brain that come from the swine or the pigs. It has caused lots of a huge economic loss at that time. SARS and pandemic H1N1, and the recent one, we had this huge flood. Just to highlight the picture of the flood, this is the stadium in Kelantan. Just to bring back the memory of 2014 huge flood. It's a public health emergency. The whole country, especially in Kelantan, was collapsed. We had the worst rain. We had rain in Kelantan that is equivalent, rain for 3 days, that's equivalent to 64 days. All the rivers in Kelantan rose up more than 50% of the danger level. No one expected this. Most people in Dabong said, just another day of rain, just another day of rain, and little they know that night the whole kampung was submerged. And he has created lots of public health emergency, because I remember receiving a call from my friend. Medivac tried to locate the Mercy station where to land with their helicopter, because the pilot, even though he's so used to land at the area of the Kelantan, he did not notice anymore the geographical landmark of Kelantan, because all water. So the public health specialist at that time having problem. Most hospitals will collapse except for HUSM. So this is the reality that hits us, and because of that we have learned so much from the 2014 Bah Kuning, the flood, and we have multiple meeting and agencies and drills and training with the government agencies, NACMA, NGOs, government hospitals. We do drills as part of our mitigation and preparedness. Now what we are doing now, we are at the phase of mitigation and preparedness. What I'm telling you now is this phase of preparedness and mitigation. The understanding must come first, then you get the actions. If you don't understand the severity, the danger of the war, you will not be preparing with the good weapons against it. Just to end up, before we end, we have a CRPC, or known as Crisis Preparedness and Response Center. It's very important for us to understand that we have Emergency Operations Center in our country, established in 2007 for the 9th Malaysia Plan, to manage DOCE. DOCE, D stands for disasters, outbreak, crisis, and emergency related to health. And in 2013, it expands the other one as well, bioterrorism, weapons, and other crises in emergency. What do we do? What is important to know that the function of EOC is there for us, because in MOH is the command center for National Crisis Preparedness and Response Center. It's become the central point for command for any occurrence of DOCE, whether it's disaster or any outbreaks or any crisis or any emergency. We report to CPRC. So the state CPRC will monitor, and if they see the CPRC is showing signs of outbreak, then we will activate, like I said, is active surveillance. And the good thing about EOC, since we have established this EOC, we have good linkage with ASEAN countries, and because of that, we have managed to work very well in a coordinated manner in facing these issues, such as H1N1, massive flood in 2014, avian flu in 2013, and missing MH370, missing MH17 crash, and as well as Zika virus. And all of us actually is part of this EOC, because it's based on our information, they will act. So take home message from my talk. I hope you have enjoyed the traveling around the world with me, with the some stories that I've told you, just to bring the idea, the understanding, and the awareness that public health emergency is a real threat. Awareness of the threat will trigger the preparedness in all our hearts. Most of you are the bosses in your respective way. Do necessary to equip the AMO, to equip the hospital with required knowledge and skills to face this possible war. And wellness-focused personnel encompasses knowledge and powerful imagination to provide solutions. So imagine yourself being the boss. Imagine being in the pandemic, what to do, what we should do, what to prepare, because Albert Einstein say, imagination is more important than knowledge. Start imagination, start imagining your solution, use your knowledge, and provide solution to mankind. Thank you very much.
Okay, terima kasih kepada Dr. Azlan yang sudi berkongsi berkaitan dengan preparedness, awareness public. So disebabkan masa kita terus ke podcast seterusnya. Saya menjemput Cik Anam Yaakob, Rakan Syamban Seremban, untuk menyampaikan sedikit cenderamah hati kepada Dr. Azlan. Silakan. Seterusnya saya serahkan kepada Tuan Presiden Majlis untuk tingkat seterusnya. Terima kasih.